So I have 4 things I have to do in half an hour. One is, how do we get in this jam? What is all this stuff anyway? Because you've spent most of the morning talking about fascinating orthopedic issues, and tonight your wonderful party, tomorrow more orthopedics. But outside of the hospital of special surgery, we're in a lot of trouble. So part 1 of my time together with you is, what is all this stuff anyway? Part 2, a quick definition of population health. That sounds corny. Don't you mean public health? No, we mean population health. Part 3, how does this all connect with health reform, as alluded to by Lou Shapiro? And part 4, Nash's view of the future. Let me give you the outline one more time, because a lot of orthopedists in the room. We've got to make a list.
But I think it's really important for us to ground ourselves in just how serious the problem is that we face. All of the red ink in the federal deficit, which is the red portion of the graph above the blue line, that is the cause of the future federal crisis that we're facing, is the rising cost of health care. Without that, the government, our budget deficits would go away. State deficits, it's the same thing. Huge increases in health care spending for states, leading to cutbacks in education, whether it's K through 12 or higher ed, public assistance. We've been able to keep up with prisons, which I don't know whether that's a good thing or not.
So there are some key facts that we all need to know, and I'm going to shift the gear a little bit to world health. Musculoskeletal conditions cause physical pain, disability, and loss of personal and economic independence. It affects millions of people in all ages, and the bone and joint decade, the Global Alliance for Musculoskeletal Health, I had a press release that said that there's an influence to influence Global Alliance call on governments, the World Health Organizations, to prioritize musculoskeletal health following the findings of their study in 2010.
But I think first, there is a difference between the old HMOs and the new model, and I think both David and I touched on it, which is that the new model is more about empowering physicians and the provider side to take responsibility, not having it stick in the health plans. So that's one. I think that who better than the health professionals to take responsibility for deciding what are the right kinds of devices and services and start to have some competition among them to give us competition on value. So if I were worried about pharma and the device manufacturers, I think who better to judge the value to come from a particular piece of technology than the health professionals who should be responsible for it.